So today I will discuss the study presented at IDPD 2021 named Neurofilament Light Predicts Worsening of Motor Symptoms, Depression and Anxiety in Parkinson's Disease. This study is a result of a collaboration with Professor Joanna Pereira from Karolinska Institute. Motor symptoms are major concern in Parkinson's disease, being associated with severe disability, with shortened life expectancy and very worse quality of life. These symptoms include mood disorders, constipation, apathy, and cognitive dysfunction. So in the past few years, numerous studies have been published on identifying biomarkers of cognitive dysfunction in PD. However, biomarkers for non-motor symptoms have been less investigated. Neurofilament light chain is a major component of the cytoskeleton and is released into the interstitial fluid, cerebral spinal fluid, and bloodstream, and has recently gained attention as a promising diagnostic prognostic biomarker for PD, with studies showing that this biomarker can predict the motor and cognitive progression. So the aim of our study was to test whether neurofilament light chain levels in the CSF and the serum are associated with non-motor symptoms at baseline and can predict longitudinal non-motor symptom trajectories. So for our study, we used data from the Parkinson Progression Marker Initiative, the PPMI. It is an ongoing prospective international study aimed to identify biomarkers for PD in a large cohort of participants. So for this study, we have used data of CSF and serum neurofilament level and non-motor symptom scales, such as the MDS-UPDRS, the geriatric depression scale, the state and trait anxiety score. So we also use data on body mass index due to its potential association with neurofilament light in the serum. So we found that serum neurofilament levels were lower in patients with Parkinson's disease compared with healthy control. And our longitudinal analysis showed that serum increased over time and was associated with the progression of non-motor symptom measured by the UPDRS and the depression score. Finally, we found that increasing longitudinal serum and CSF neurofilament were also associated with worse longitudinal non-motor symptoms, depression, and anxiety. So finally, we found that neurofilament levels can predict non-motor symptoms scores and depression. And we found that longitudinal changes in serum and the CSF neurofilament were associated also with worse longitudinal anxiety in PD patients. So recent study in PD have shown that blood neurofilament is strongly correlated with serum neurofilament light chain and is associated with worse motor and cognitive progression. So in this study, we extend these findings by showing that neurofilament can also predict non-motor progression, which is very timely due to the lack of biomarkers of non-motor symptoms in Parkinson's disease. So it is interesting noting that among the specific non-motor available non-motor scales, only the progression of depression, depression and anxiety was associated with the neurofilament levels. So we think that this can be due to the possibility that neurofilament could be more closely related to neuroaxonal injury, and therefore the progression of these symptoms can be predicted by serum and CSF levels. So in conclusion, our study demonstrated that neurofilament predict non-motor symptoms, supporting the hypothesis that neuroaxonal loss is an important factor underlying neurocognitive and psychiatric symptoms in Parkinson's disease.